Your face is the most obvious indicator of how you feel. Overactive muscles in the forehead, heredity, and aging cause wrinkles, creases, and a loss of firmness in the upper face, giving you the appearance of being permanently tired, sad, or angry. A brow lift can smooth creases, diminish frown lines, and improve moderate hooding in the eyelids, restoring a more youthful, alert, and relaxed appearance in the eyelids and brow. This presentation will give you a general overview of the brow lift procedure. It is not a substitute for a complete consultation with a qualified surgeon. A complete consultation will include the discussion of your goals and expectations for the procedure, an evaluation of your specific situation, a recommended course of treatment, and a discussion of potential risks and complications. Any questions and concerns should be addressed during the consultation. Full disclosure of your health history is important to your safety. This includes any history of medical conditions or illnesses in your family, your current use of any medications, vitamins, herbal supplements, as well as any alcohol, tobacco, or drug use. Good candidates for brow lift surgery are healthy men and women with no life-threatening illnesses or medical conditions that could impair healing. A positive outlook and reasonable expectations are also important. Patients who smoke are at increased risk of poor healing. They are advised to stop smoking for several weeks before and after surgery. Prior to your procedure, you will be asked to sign informed consent documents. These are used to make sure you fully understand the procedure, including any risks and complications, and that you commit to following any and all instructions you are given. These include pre-surgical considerations, day of surgery instructions, and information relating to the use of anesthesia. A brow lift is often performed along with other rejuvenative surgical procedures like eyelid surgery and facelifts. Multiple procedures will increase the length and complexity of surgery, as well as the risk of complications. This should be discussed carefully with your surgeon. Botulinum injections, such as Botox, may be recommended prior to surgery in order to relax underlying muscles prior to their repositioning and tightening. Further injections may be suggested following surgery to help maintain results. Brow lift techniques vary. Factors such as your anatomy, the position of your hairline, and your appearance, as well as the amount of improvement necessary, will factor into the technique or combination of techniques your surgeon will recommend to realistically achieve your goals. A brow lift is minimally invasive, placing limited short incisions within the hairline. Through these incisions, muscles that create expression lines and the resulting furrows and creases are removed or weakened. A low brow may be repositioned and secured inconspicuously at the temples by permanent sutures, small surgical screws, or an absorbable fixation device. An incision along the natural contour of the upper eyelid may be recommended to address furrows between the brows. A coronal incision is an alternative brow lift technique that extends across the crown of the head within the hair. This allows your surgeon to access the underlying muscles of the brow and forehead region and reduce excess skin that contributes to a lower, sagging brow. Following the procedure, sutures, skin adhesives, tapes, or clips will be used to close the incisions. Your head may be loosely wrapped to minimize swelling and bruising. Bruising, swelling, soreness, and numbness are all common side effects with brow lift procedures. Any discomfort or pain you feel can be controlled with medication. Skin may also feel more firm than usual, and incisions may become itchy as they heal. Some facial movement may also be temporarily impaired. As with any surgery, possible complications may arise. These include areas of temporary hair loss or numbing within the scalp, poor healing at the incision sites, and bleeding beneath the skin or hematoma. Although extremely rare, facial paralysis could occur. An elevated hairline is also possible. The use of anesthesia in any procedure presents its own risks. You should keep your head elevated at all times until initial swelling subsides. A return to light, normal activity is usually possible within a few days of surgery. After 5 to 10 days, swelling will diminish rapidly, and any sutures or clips will be removed. You should be ready to return to work and regular activity at this time. Healing will continue for several weeks as swelling resolves completely and incision lines continue to improve. Diligent sun protection is recommended until the healing process is fully complete. This is especially important if you have had any resurfacing procedures. While they are long-lasting, the results you achieve are not permanent. You will continue to age naturally over time. However, most patients find that the benefits of their brow lift last for many years. It may take a year for incision lines to fully improve, but your new, more youthful and alert appearance will be apparent. The positive, energetic outlook you feel inside will once again be reflected on your outside.